We've all heard the phrase worried sick at some point, but for people with hypochondria, there's no saying more ironic. Hypochondria is an anxiety-related mental health disorder in which a person has extreme fear and worry that they're seriously ill, despite all contradicting medical evaluations showing no presence of a problem. It's normal to occasionally worry that one may have an illness. Most people do. But people with hypochondriasis are consumed with fear. The fear is severe and persistent and interferes with work as well as relationships.
I'm dying. I'm dying. I know it. There's a spot on my lungs. All right, now take it easy, will you? It's not on your lungs. It's on your ear. It's the same thing, isn't it? Oh, jeez, I can't sleep. Oh, God, there's a tumor in my head the size of a basketball.
Hypochondriacs misinterpret normal bodily functions or minor health issues as signs that something is very seriously wrong. For example, a hypochondriac may misplace their wallet and become convinced that they've developed Alzheimer's disease. Or they might be certain that a standard headache is really caused by a malicious brain tumor. An estimated 70% of people with this condition also suffer from another mental health disorder, namely major depression or an anxiety disorder. The cause of hypochondria is unknown, but doctors have found that those with a history of physical or sexual abuse, had a hypochondriac parent or relative, or had a serious childhood illness are at increased risk for developing hypochondriasis. Whatever the cause, hypochondria is tough to treat. Patients have a hard time realizing that their problems are mental, not physical. Psychotherapy, such as group therapy, behavior modification, and cognitive therapy, are commonly used to help patients change the thinking and behaviors behind their symptoms. Doctors may prescribe selective serotonin reuptake inhibitors, SSRIs, which can help treat the anxiety fueling the disease. These medications do not get rid of their disorder, but help the patient live as normally as possible with the disease.
I think that's a really important point.
Dr. Arthur Barsky is Director of Psychiatric Research at Brigham and Women's Hospital in Boston. He's been studying hypochondria for 30 years.
It is not a joke. I mean, from their point of view, they really do have a brain tumor or lupus or multiple sclerosis. It's a belief system. And so they really are dying 1,000 deaths.
Hypochondriacs do have pain, but there is no clear medical diagnosis for that pain. Studies show that 1 in 20 people in a primary care doctor's office are hypochondriacs. It affects men and women equally.
In most cases, what does the hypochondriac want the doctor to do?
Pay attention to them. Physical exams, time, explanations.